Hello, my name is Katrina Caesar, and this is for Psych 4640. This is my psychophysiology project, and I chose bipolar disorder. We're going to start with what is bipolar disorder? Is it a gender disorder, an ethnicity disorder, or is it just a figure of our imagination, something that we're making up? Now, it is not something we made up. According to the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5, bipolar disorder is a severe chronic mood disorder characterized by episodes of mania, hypomania, and alternating and intertwining episodes of depression. So today in talking about bipolar disorder, we will start with the side effects. Then we're going on to the neurological basis of the disease, and we will finish with the neurological treatment. So let us start with the side effects. Now, what I found was, what I found was the side effects. But as we already know, a person that is diagnosed with bipolar disorders, they suffer from episodes of mania, hypomania. So now we're going to discuss the side effects of the being bipolar. I'm sorry. Now, the most common side effects of being bipolar is subsynonymal depressive symptoms, or a full depressive episode with concurrent manic symptoms. Now, you might be saying, what is supersynonymal subsynonymal depressive, or the one that we can pronounce full depressive episodes with concurrent manic symptoms. Well, based on what I found, it is a depressive state of having two or more symptoms of depression. So, the most common effects of being bipolar is sedation, nausea, loss of appetite, mild diarrhea, dizziness, fine hand tremors, and increased production of urine and excessive thirst. Those are the ones that I found for bipolar disorder. So let's just go ahead and move on to the next one, the neurological basis of the disease. Now that we moved on to the neurological basis of the disease, the first one is called a neurological mechanism and systems. What is bipolar disorder? So what I found was that the neurological mechanism slash system, it contains a gene code. Now, the gene code for a calcium channel subunit that affects the amygdala processing of emotional events. Now, you're wondering, where is that gene located? But the gene is associated with major depression. What was wrong with the gene is a base pair difference in the gene. So it was a single nucleotide polymorphosis. It led to the insertion of methylone in the BDF protein instead of Valium. So I believe that Valium was supposed to be there, and instead they found the methylone. Now that we know the neural mechanisms and systems, let's move on to what parts of the brain affects bipolar disorder. As you see in the picture, there's a comparison. Of course, the one that says normal brain, that's how a normal brain works. And then the other one is what a bipolar brain works. So let's find out what we have found. Along what we have already found is, the CACNA1C gene. It has been shown to be one of the central differences in brain function and bipolar disorder. I found a study, and it is shown that it compares bipolar patients compared to normal people brains. So what it found, it found that images show that it decreases in the volume of the brain's prefrontal cortex and its subcortical connection sites. And that includes the amygdala in individuals with bipolar disorder when compared with persons without bipolar disorder. I found this in Science Update. So now that we know what parts of brain affects the bipolar disorder, let's move on to the I had to do that. Um, the diffuse modulatory systems. Okay. As you see, I found the picture of the diffuse modulatory systems, which I thought was nice. So let's see. There were three of the diffuse modulatory systems. The first one was a norepinephrine levels were reduced by by lithium. So patients taking lithium, the norepinephrine levels were reduced. Patients taking SSRIs, their serotonin levels were enhanced. And lastly, they had an elevated glutamine excitatory. And the last one we're going to discuss before we discuss the treatment um, is the neurotransmitters involved in bipolar disorder. So, the neurotransmitters involved for bipolar disorder is called the biogenic amines. The biogenic amines is in the limbic system. So you wonder what the limbic system does. So it is implicated in the regulation of sleep, appetite, arousal, sexual function, endocrine function, and emotional states such as fear and rage. And lastly, we're going to discuss the pathophysiological, hopefully I said that right, effects of bipolar disorder. Okay, the pathophysiological effects. It affects the striatal and frontal cortical neurotransmitters, neural circuits, and the interacting cholinergic, decatcholinergic, and serotoninogenic transmitters. Hopefully I said all those right because those were tongue twisters. Now that we discussed the side effects, we discussed the side effects, as we already know. And then we discussed the neural mechanism and systems, and that include the parts of the brain, the diffuse modulatory system, and the neurotransmitter involved. Let's move on to the last one, the treatment of neurological treatment of this disease. As you can see, the boy is frustrated because I guess he didn't get treatment, but I thought it was a pretty picture. So, the drug of choice for treatment of bipolar disorder is lithium. Now that we know that the drug of choice is lithium, we know that lithium is a mood stabilizer. It is mainly prescribed for the prophylaxis of bipolar disorder. Individuals with bipolar disorder have an increased right lateral ventricle, left temporal lobe, and a right putamen volume. Okay, let's move on. I wanted to include some research on this medication and also bipolar disorder in essence, and this is what I found. Okay, patients taking lithium, excuse me, I'm sorry, found that lithium can help restore brain volume deficiency. And it's also noted that hypothyroidism and other thyroid conditions may occur with long-term use of lithium. And also, individuals with bipolar disorder have an increased right lateral, oh, I said that, increased right lateral ventricle, left temporal lobe, and right pudendal volume. Now, what was interesting with this research was they compared with bipolar patients, ones without taking the medication, not on the medication, and the one with. So the ones that are not taking lithium had a reduction in the cerebral and hippocampal volumes. Patients that were on the medication, they displayed a significant increase in the hippocampal and the amygdala volume, which is good. Let's move on to alternatives. Everyone wants to know the alternative to medication because does not agree with taking medication for bipolar. So I found a couple. I found three. Now the alternatives is fish oil and fish because of the omega-3 fatty acids. And they found that hopefully I say these right, icosapentaenoic acid and docosahexaenoic acid, DHA, they have chemicals in the brain that are associated with mood disorders. So that was an alternative. And also I found that adding 2 grams of N-acetylcholine per day to with traditional treatment, it led to significant improvement in depression, mania, and the quality of life. And it is also noted that taking the 2 grams of N-acetylcholine per day with traditional treatment, it is helpful for bipolar patients. Let me go back right quick. Click the wrong button. Go back. Go back. Okay, it's not going to go back. So this is the conclusion. So in conclusion, in talking about this disorder, again, we started with the side effects. Then we moved to the neurological basis of the disease, and we finished with the neurological treatment for bipolar. It is noted that bipolar disorder, it is a mental disorder that affects more than 2 million people each year. So my goal for this presentation is to explain bipolar disorder and the neurological effects of the disease. And in conclusion, bipolar disorder is a condition that needs to be treated professionally. Thank you for listening.